Now I want to focus on diabetic ketoacidosis. Alright, so what is a treatment for diabetic ketoacidosis? So it's just to define diabetic ketoacidosis, then quickly go into what the various treatments you could actually apply to this. So for diabetic ketoacidosis, the treatment is mainly the person is dehydrated, right? So when somebody is dehydrated, what do? You replace the fluid that the person has lost. Okay, so fluid replacement is the initial therapy. So you focus on trying to restore the circulatory volume with intravenous fluids. Okay, so the most used one is the isotonic saline. So that will help to correct the dehydration, it will improve perfusion, and it will reduce glucose concentration. The insulin therapy, so they will continuously be giving insulin to that patient, all right, because the body is actually lacking insulin, and the body is now trying to break down lipids for energy, So insulin will now shift the metabolism from breakdown of fat to breakdown of glucose, so it will now reduce what? Ketones. So electrolyte correction, you give potassium if there's hypokalemia. So potassium replacement if levels are low or trying to threaten to go down low. Alright. Sodium and phosphate may also be required. So for acid balance, acidosis usually is improved with fluids and insulin. Bicarbonate therapy is rarely needed, Then also identify and treat underlying cause. So most of it is due to something, infection, the person has missed their insulin drugs, okay, myocardial infarction, stroke, all those things that could stress the system is what usually triggers what? The start of what? The episodes of diabetic ketoacidosis. So identifying them is very, very important.